How does fiber decrease the risk of cardiovascular disease? What is cardiovascular disease? Cardiovascular disease is a group of diseases that affect the heart and blood vessels, including coronary heart disease. This is when there's plaque buildup in the coronary arteries. Hypertension, this is high blood pressure. This causes damage to arterial walls. Peripheral vascular disease, this is restricted blood flow to arms, legs, and other body parts. And heart failure, this is when the heart cannot effectively pump blood to meet the body's needs. Closely related to cardiovascular disease is atherosclerosis. Atherosclerosis involves plaque buildup in the arteries, which can limit blood flow. It can lead to heart attacks, strokes, and other cardiovascular diseases. What is fiber? Fiber is a carbohydrate found in plant foods that the body cannot break down. Soluble fiber dissolves in water, and then there's insoluble fiber. This does not dissolve in water, it absorbs water. Fiber is food for gut microbiota. They digest fiber and produce short-chain fatty acids. The WHO recommends eating 25 to 35 grams of fiber daily. Benefits of fiber. Fiber helps promote healthy weight, helps lower cholesterol, reduces the risk of type 2 diabetes, feeds good bacteria in the gut. Soluble fiber helps reduce diarrhea, and insoluble fiber reduces constipation. This also lowers the risk of diverticular disease or hemorrhoids. Fiber also reduces the risk of certain cancers, particularly colorectal cancer and gastric cancers. Fiber also reduces the risk of all-cause mortality. Dietary fiber is inversely associated with total death rates, including cardiovascular infections, respiratory deaths, and cancer in men. How does fiber reduce the risk of cardiovascular disease? Fiber promotes healthy weight. High fiber foods are more filling and increase satiety. Low fiber intake is associated with high BMI. Fiber intake is inversely associated with BMI. BMI is body mass index. A healthy body mass index is considered between 18.5 and 25. This study showed patients who ate more fiber had a lower body mass index over the course of 18 months. Fiber helps lower cholesterol. High cholesterol increases chances of developing atherosclerosis. Fiber reduces the risk of type 2 diabetes. Fiber does this by helping control blood sugar levels by slowing gastric emptying, digestion, and absorption of sugar. Cardiovascular disease affects 32% of people with type 2 diabetes and accounts for half the death in these patients. Fiber also feeds good bacteria in the gut. This increases short-chain fatty acid production. Short-chain fatty acids help reduce inflammation, and short-chain fatty acids influence blood pressure regulation, which helps lower blood pressure. There have been many studies about cardiovascular disease and studies about diabetes. The Bogalusa Heart Study showed characteristics of atherosclerosis, hypertension, and diabetes can be present even in childhood, leading to later diagnosis of cardiovascular disease. A recent study showed high-fiber diets are shown to lower cardiometabolic risk factors such as obesity, hypertension, and insulin resistance in young adults. Undergraduate students consuming high-fiber diets for a 12-week study had higher fat-free mass, less percentage of body fat and waist circumference, less lactobacillus bacteria in their gut, and less Eubacterium bacteria in their gut. Diets rich in dietary fiber are shown to improve blood pressure in adult hypertension patients. A recent study showed that patients who ate the recommended amount of dietary fiber were able to significantly reduce blood pressure in only 3 months. Systolic pressure went down 15 points, and diastolic pressure went down 10 points. Systolic blood pressure is the pressure in your arteries when your heart beats. Diastolic blood pressure is the pressure in your arteries between beats. People with diets high in poor quality carbs, those are carbs with high glycemic index, are at greater risk for cardiovascular disease and death. Here we can see results from 3 different studies showing that the risk of death from cardiovascular disease is greatly increased by having a diet high in glycemic index. Glycemic index is how much certain food increases the blood sugar. Diets with high glycemic index are linked to increased risk of diabetes. This is a risk factor for cardiovascular disease. What foods have fiber? Lots do. Some examples of fiber-rich foods would be whole grains. This would be whole wheat bread, oatmeal. If you're not sure, look at the label. You want to find the word whole in the ingredient list. Things like seeds and nuts, chia, flax, and pumpkin seeds, almonds and pistachios, fruit like strawberries, blackberries, apples, pears, and oranges, beans and lentils, navy, pinto, and black beans, chickpeas, and split peas, vegetables like broccoli, carrots, kale, acorn, squash, and sweet potatoes, or you can use fiber supplements. Conclusion. Eating the recommended amount of fiber, 25 to 35 grams per day, reduces the risk for cardiovascular disease. Fiber helps reduce the risk of cardiovascular disease by promoting healthy weight, lowering cholesterol, reducing the risk of type 2 diabetes, and increasing short-chain fatty acid production. The cardiovascular benefits of fiber are apparent at any age, and making dietary changes to incorporate more fiber can help prevent cardiovascular disease.